Well, Nigerians are raising concerns over the rising cases of monkeypox in the country. Well, according to the Nigerian Center for Disease Control Situation report, the disease has spread to 26 states and the Federal Capital Territory. Well, experts are calling for increased effort to mitigate its spread. And our correspondent, Benny Ark, has more.
Since the beginning of this year, several countries have witnessed an unprecedented outbreak of monkeypox, prompting the Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, to in July declare monkeypox a public health emergency of international concern.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
According to the Nigerian Center for Disease Control, NCDC, a total of 15 confirmed cases of monkeypox disease were reported between August 1 and 7 in 10 states. In its situation report, the agency named the affected states as Imo, FCT, Ondo, Rivers, Abia, Anambra, Ebonyi, Edo, Ogun, and Nasarawa states. Since the beginning of the year, a total of 172 confirmed cases of the disease have been recorded. However, between January and August 7, 60 suspected cases were reported. Of these 60 suspected cases, 15 were confirmed in 10 states. To date, there are now 473 suspected cases from 27 states, with 4 associated deaths recorded from 4 states. The NCDC says since the reemergence of monkeypox in 2017, there are ongoing efforts to strengthen surveillance at national and subnational levels in order to increase awareness and to promptly detect and respond to the outbreak. Benny Ark, Arise News.
And joining us now is infectious disease expert as well as Professor of Virology, Wale Tomori, the right person to have this conversation with. Prof, good to have you in the studio.
My pleasure.
Well, let's take a look at the fact that monkeypox is not new to us here in Nigeria. I remember this has been around since the 50s, but here in Nigeria, we had our first case as early as 1971. And in 2017, we had a major outbreak, which was considered our largest outbreak so far. But in recent times, we've seen the world really experience more and more of monkeypox. Would you say the same variant that we have here in the country is the same thing that is obtainable in Europe? I ask you this because some of the cases here in the country have not really been traced back to men having sex with men, which is what is obtainable elsewhere.
Thank you very much. You're correct. The first time we reported was in 1970, but 71. But between that time, we didn't seem to have reported anything. There are many reasons for that. At that time, there was a lot of smallpox vaccination, and there's some cross-protection. But remember, since 1980, we stopped vaccination with smallpox. And therefore, more people who have never been exposed to smallpox vaccine are available. And the virus is always around, among different, we don't even know which is the, the natural host. There could be different types. So now I think we're getting a situation where 70% of the people have never been exposed to smallpox vaccination and therefore are not immune or protected. And so the cases will start coming. I think there's a greater awareness now, improved surveillance, and that's why we're getting more cases, especially with the explosion that happened in Europe and other places. Two different things. The situation in Europe, when it started with occurring in different countries or different places, actually baffled the world. Yes. But now we know the reason. There was a common cause, and that was the May sex, whatever they call it, and the festival they had in different places. So when they went back to their countries, the cases kept popping up. I think that also increased the awareness, and we're seeing more cases. Since 2017 in Nigeria, we've been seeing more cases coming up. In particular this year, I think we've had more than we've had before. I put that to the fact that surveillance has improved, right, and people are now more aware of it.
Okay, because this is not new to us, like Amaka said, in Central Africa and West Africa. However, we saw it in Europe. So, Prof, do you think that we need to be worried about it since we're seeing a different spread? I mean, spread in the cold for the first time. Should we be worried? And how dangerous is monkeypox?
Any disease anywhere that is neglected will spread everywhere. And that's what is happening with monkeypox. It's been with us 50 years. Nobody really cared too much about it because it's not that as severe as COVID, for example. It doesn't spread as fast as that. It's a self-limiting disease. So really, it didn't. And the number of deaths we had since 2017 was just about 5. So, and you know, that's a small number, unfortunately, for Nigeria, but people should worry, even one person dies, you know. So now, and then there are 2 different types. The one in the Central Africa, which has now been named Clade 1, seem to be more severe than the one in West Africa, which is Clade 2. The one in Europe actually must have originated from West Africa, so it's Clade 2 type they have in Europe, which is less severe than what we have in Central Africa. So really, I think we should be worried about it because it's going to keep spreading. But you see, the good thing about it is that if you do your good surveillance, good disease diagnosis, you can identify the cases and you can isolate them. And once you isolate and make sure that you practice your infection prevention and control, then the disease is self-limiting.
I like
and
how
there
you
it ends.
qualify it as good, good, good.
Yeah.
Does Nigeria have good, good, good?
No. Let's be frank with ourselves. We don't have good. I mean, sorry to say, we don't have good in virtually anything.
Right.
So that's a problem. And that's why you're seeing the thing spreading.
That's quite troubling because a small country as small as Togo just yesterday was actually announced as the very first country globally to eliminate 4 tropical diseases. Nigeria, a lot of the times when you hear our name when it comes to diseases, it's not good, 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 like you put it.
Yeah.
But at the end of the day, let's not forget from pandemics to epidemics and all that is happening around the world, from the COVID-19 to Ebola, which has resurfaced in the Congo, to even Marburg, which is just around the corner. How would you rate Nigeria's preparedness for the next epidemic or even a pandemic? Lessons learned from COVID helped us, or do you think there's room for improvement, really?
You know, we have this thing about lessons forgotten. We learn lessons and soon we forget it and we start all over again. And I'll give you one good example that is happening. You remember when Ebola came?
Yes.
The story was that Nigeria had only about 3 or 4 laboratories. And then we upped that up to 140. Go and check the records now. 50% of those labs are no longer working. They're either not reporting, there's no staff, there's no equipment. That is the problem. I mean, once the epidemic goes down, we forget what we have built. I expect when the next pandemic comes, we say the same story. Oh, Nigeria has only 3 laboratories that can carry.
So sustainability is the issue. So how can we get better in that aspect?
We need to keep letting people know that these epidemics will keep occurring. And must be prepared for it. Preparedness is the whole thing. Sustaining it. Unfortunately, because when you do a good surveillance, you don't see disease and you say, no, there's no, you don't notice the effect. But then one disease will then wipe out all of the good economy you have. So we must put that at the back of our mind, that all we require is just one COVID and our economy will go into recession. So that message must be constantly put in front of our people. And that's why we need to put, and the cost of surveillance is minimal compared to what it will cost if you don't prepare for it. I think we need to keep getting that message out to our people. One kobo into surveillance will save you 100 naira, when the epidemic comes.
So prevention is not only better than cure, it's cheaper.
It's much cheaper.
That's what
much cheaper.
And so because of where we are, we should be focusing on transmission prevention, is what you're saying. How do we do that? I mean, how do people catch monkeypox?
The first thing is surveillance diagnosis. Laboratory support, so that because there's so many things like rash that starts like that. So you won't know whether it is rash of measles or rash of whatever until then comes in. So therefore you need good laboratory backup to your surveillance. Immediately you do that, get into what we call isolation. You put the cases into isolation, and we use the word IPC, infection prevention and control. The health workers who are working with them, they keep all the usual paraphernalia, IPC dress and all the PPE and other things, so they don't get it transmitted themselves. Immediately you know somebody has it, and it is not usually spread only by sexual contact, direct contact, because of the lesions that will form in the body.
So is every scratch a suspect? Because it starts by scratching.
Yeah, every pox or whatever you find is loaded with virus.
Okay.
And that can contaminate even the table where you are, wherever the person touched, the beddings and everything that the person has, that's the reason why.
So aside from the pox, what are the other symptoms that people really should be looking out for?
Usually, like most viral infection, all you get, you start with a fever, prodromal. There's not really clear until this pox comes out, But even that period, you can also have transmitted the disease through respiratory form, before you see the pox coming in. So That's where the problem. When people get sick, the earlier you get them into look at when they start having the body ache and headache and fever and all that, then please go to hospital as quick as possible.
For a country where every fever is malaria, how much of a challenge is detection of major viruses and even diseases in the country? I ask you because you are a virologist. You spend a lot of time on that.
It's a big challenge, but it is also because we have failed to build on the things. I mean, laboratories are popping up everywhere in the world. They're making it as exciting as possible to get quick diagnosis. But we don't do that, and that's what we're paying for. Years of neglect of our laboratory system. And that's where we are today.
Well, COVID-19 pandemic has changed the way the world is responding to disease outbreaks. Unfortunately, you're saying, we learn lessons and we just forget
Almost
them.
Immediately.
But let me ask you, before we let you go, where do you think we are with the COVID-19 pandemic at the moment? And I think Amaka touched on this earlier. Are we able to handle all of this all at once? Monkeypox, Lassa fever, COVID-19 pandemic.
The health system we have now cannot handle that. Oof. And I mean, let's be frank with each other. And anybody who tells you we are prepared for the next epidemic is deceiving us. We are not prepared for the next epidemic. Let's be frank with ourselves. With the way we're handling things, I mean, you see reports are coming about monkeypox. COVID report, we get report after 2 weeks or the combined result. That's not the way things are done.
So how can we prepare better now? Because you have talked about investment in the past that we've put in, yet we don't sustain that. So how can we do better?
I had the person who was talking before, talking about certain things we have in our place, like culture. Those things about integrity, those things about you talk about build back and build forward. We need to build back on the things that made us a nation of integrity. And then you can build forward on this, because if you don't do that, all the infrastructure you build will be destroyed because you don't have basic integrity. That's the problem. So sustainability and ensuring that, whatever you put in, people react and do their work, in everything. So you can't have a lab where the person doesn't go to work in the lab or doesn't do the work properly. We are back to the same square one, So integrity plus the fact that government should continue to put funding and get the message to the government that it's cheaper for you to put your money into surveillance than to wait for an epidemic to come.
But the government says it doesn't have enough money.
Who said that?
How fund? They keep complaining about
people, is it not the same country?
So the reason why I ask you this, because even if you don't agree with the stance that the government doesn't have the money for it, but where's the part of public-private partnership in terms of health surveillance, which you say is priority if we have to get national health security in Nigeria?
The private, we want to work with public that is reliable. You cannot have government misspending money and then you have the private join them. I mean, forget it. Let's face the fact. And when you say we don't have money, I still don't agree with that one. If we have 20 million to buy a electoral form, we have money.
Okay, 100 million for some people.
Prof, sorry, 200 million.
100 million was the highest.
Yes. But Prof, I mean, I do apologize. I lumped up the last question. I wanted to find out where we are as a country when it comes to COVID-19 pandemic. Is it over?
It's not. Well, we've seen the reports are coming out. If 50% of your laboratories are no longer testing, you're not actually getting the real figure. So what is NCDC is putting out is the tip of the iceberg. The labs are not testing. Many people are not, everybody has abandoned it. But go back in other parts of the world. People are still coming into this country who are coming with COVID into the country and spreading it. And if we break all the laws, where is our task force? Have you ever heard anything from them for the last 2 months or 3 months? No, they could have abandoned it. So everybody has abandoned the whole thing. It's still around, and we better be careful.
Wow.
Thank you so much.
My pleasure.
Professor Wale Tomori, is always wonderful to have you share your expertise and insights with us. We do appreciate it.
Thank you for being here.
Thank you very much. My pleasure.